Rocky Mountain Spotted Fever caused by Rickettsia rickettsii. Now, Rickettsii is an obligate intracellular organism, meaning that it cannot reproduce outside the host cell. It needs resources from an intracellular source. Now, can you think of any other bacteria along with Rickettsia that are obligate intracellular? Well, if you're thinking chlamydia and also Coxiella, then you're spot on. These are also obligate intracellular organisms along with Rickettsia. I'll put Rickettsia up here just for the sake of not forgetting about that being obligate intracellular. So Rickettsia cannot synthesize their own ATP. They need to get their ATP from their host cell. So first aid makes a note that they need some way of getting CoA and NAD+ from the host cell. So the disease is caused by Rickettsia rickettsii. The vector for this is the dermacenter tick. Whenever you see dermacenter, you shouldn't just be thinking Rocky Mountain Spotted Fever. You should also be thinking Francisella. These are two possible diseases that the vector for is the dermacenter tick. It occurs primarily in the South Atlantic states, especially North Carolina. Now, there is a classic triad caused by this disease: headache, fever, and also a rash. I'm going to go ahead and put in parentheses vasculitis. Okay, so this is the classic triad that we're going to be seeing with this disease. A little bit more about the pathogenesis of Rickettsia is that it's going to be invading endothelial cells that lining the capillaries, causing a vasculitis in many organs like the brain, liver, lungs, kidneys, skin, and GI tract. The rash that this causes typically starts at wrists and ankles. So it starts here and then spreads to the trunk, palms, and soles of the feet. Other diseases that affect rash on palms and soles are going to be Coxsackie A infection, commonly referred to as the hand, foot, and mouth disease, and also secondary syphilis. So secondary syphilis, if you can recall, there's primary stages, the secondary and the tertiary stages of syphilis. In the secondary stages of syphilis, you're also going to be seeing a rash that involves palms and also the soles of the feet. So definitely reviewing some high yield and important concepts that can certainly pop up on the USMLE exam. A mnemonic that first aid uses to help the student remember the organisms that cause rashes that affect the palms and the soles is the mnemonic CARS. So I'm just going to go ahead and put C-A-R-S, CARS. And what that stands for is Coxsackie A, Rickettsia, and secondary syphilis. CARS, and you can think of it also in a way of you use the palms of your hands and the soles of your feet to drive a car. So it's just a mnemonic that first aid uses to help you remember the bacteria that cause a rash involving the palms and the soles. But I can't stress it enough that differentiating Rickettsia based upon the rash and how it kind of progresses, starting here and then spreading to the trunk and the palms and the soles, that is just a very high yield thing that you need to kind of keep your eyes out for, right? Don't forget the areas where we're going to be primarily seeing this occur at, those South Atlantic states, especially North Carolina. In the clinical vignette, they can also be referring to any really East Coast mountainous areas. Also in the vignette, we're going to be looking for outdoor exposure because they're going to be around ticks. So how do we diagnose, DX for diagnose, Rocky Mountain Spotted Fever? We're going to be mainly looking for the clinical symptoms in the vignette, and also if they're referring to a tick bite or to an outdoor exposure where the possibility of a tick bite could happen, that's certainly going to be a clue for that diagnosis, obviously. But the serological IFA test is most widely used to make the diagnosis. Now, although it's no longer used, examiners can still ask about the Weil-Felix test. I hope I'm pronouncing that right. It's no longer used, but they can still ask about how a diagnosis could be made, and Rickettsia and Rocky Mountain Spotted Fever is going to be turning up positive on the Weil-Felix test. To prevent this disease, we want to protect from tick bites And also, if we see any ticks on the person or on our pets, we want to do a prompt removal. For exposed persons, doxycycline is effective. Okay, so I'm going to go ahead and put, for treatment, we're going to be using doxycycline. Doxy. Now, a little time with the drugs. Tetracyclines also include demethylocycline and minocycline and also doxycycline. Something unique about doxycycline is that it's the only one of the tetracyclines that's excreted hepatically. It doesn't go through a renal excretion. It's a member of the tetracyclines. It's the only one that is hepatically excreted, so it does not go through renal excretion. And just for some review, let's remember that tetracyclines, they're bacteriostatic. They bind to the 30S and prevent attachment of amino acid tRNA. They have limited CNS penetration. Because doxycycline is the only one that is hepatically excreted, it does not go through renal excretion. It can be used in patients with renal failure. It's just a high yield point I want to mention. We don't want to take tetracyclines with milk, antacids, or iron-containing preparations because divalent cations inhibit its absorption in the gut. Tetracyclines accumulate inside the cell, which makes them very effective against Rickettsia and chlamydia. Now, I'm running out of room here, but just to review some of the side effects of the tetracyclines, they can cause GI distress, discoloration of teeth, and inhibition of bone growth in children, photosensitivity, and also these are contraindicated in pregnancy and contraindicated in children. So I just wanted to make a quick little mention on that. Drugs and side effects, they're high yield for exams. That's pretty much it. Don't forget that Rickettsii is associated with that dermacentered tick. That's really high yield to know. Also, the dermacentered tick can be associated with Francisella tularensis. Rickettsia is an obligate intracellular organism. We talked about where we're going to be seeing Rocky Mountain Spotted Fever, primarily in the East Coast and South Atlantic states, especially North Carolina. We can make the diagnosis with that IFA test, and also they can ask about it being Whale Felix test positive. The classic triad is something we never want to forget, and especially that rash. It's going to be at the wrists and ankles and then spreading to the trunk and also the palms and soles. Don't forget about the CARS, Coxsackie A, Rickettsia, and secondary syphilis. And then we kind of closed up with that doxycycline, so high yield.